Right now we're going to be talking about physical therapy, and this is something that, you get that ache, you get the pain, you go to the doctor, and they say, you know what you really need? I want to send you to a physical therapist. What do you do?
That's a
Will
great
Smith.
question. That's a great question. Great to be here. Thanks
Yeah.
for having me. That's a great question. Most times that's what happens. When a doctor sends a patient to us, they have a problem and we have to figure out a solution.
Okay.
So I know in the past, Ann and I have talked about things like direct access and seeing patients directly, and a lot of times physical therapists, it's our job to kind of take a look at the patient as a whole and try to figure out what their problem is.
Mm-hmm.
And that's kind of how I started my practice about 3 years ago. And I've been practicing in the area for over 13 years now, and I've tried to apply a little different spin to how a physical therapy practice is based.
And what is your spin?
Basically, my motto is building better bodies from the ground up, and that's not a cliche. Basically, about 10 years ago, I got another certification to become what's called a certified Pedorthist. Most people know what physical therapists are, but a certified Pedorthist is somebody who specializes in foot orthotics and foot biomechanics.
So that's if your body's a little bit off kilter.
Correct.
One leg is shorter than the other.
Absolutely.
I mean, that's got to throw your spine, everything else off.
Problems like pronation, foot problems, ankle sprains, all these things relate to the rest of your body. And I've been recently giving talks about knee pain, and a lot of people come into a physical therapist for knee pain. There are about 20 million doctor visits a year for knee pain. But most times, when somebody has knee pain, it's not the knee that's the problem. It's either something below or something above, usually the foot or the hip. So I try to combine both aspects of my practice, looking at the foot biomechanics, looking at the hip, and then trying to solve a problem. You know, I think a lot of times in healthcare, people are so focused on treating the problem, treating the symptom, they don't look at the overall picture and look at the patient as a whole.
You're absolutely right. We need to look at the whole picture, because if you do this little micro, I mean, you're looking for the problem there, and you might not find it, and then you're doing something more dramatic. Maybe we need to do a little surgery, and maybe we can avoid some of that by taking
a more holistic look. Yeah, because like you said, most times people come in for knee pain, and what do? You treat the knee pain, but you haven't solved what's causing the knee pain. Somebody comes in for back pain. Yes, you can treat their back. You can do all the good stuff that makes it feel better, but what are you doing to solve that person's biomechanics and get them functioning and doing the things they want to do? Because that's really the most important thing, is keeping people active. People are doing more now.
They are very active, and people are running. They're doing a lot of things. I did want to ask you, suppose I have this shoulder pain. I don't, but suppose I did. And now, do I go to a doctor, or would I check with a physical therapist? We can go directly to a physical therapist for at least 10 visits.
Correct.
And can you make an assessment of
Yes. In New York State now, we do have direct access, so somebody could come directly to me. I can do an evaluation, make a plan of treatment. Most times, after I do my evaluation, I'll confer with the primary doctor or the orthopedist, but we are allowed to provide treatment without a prescription. Most times, for insurance purposes, we'll get a prescription, and also just for good communication. I always like to involve all the other disciplines and inform them of what we're doing. So,
yeah, it's a good idea, but if a simple sprain or a strain, It seems to me you really don't need to see a physician for that.
Right. Most times when we get prescriptions from doctors' offices, it's evaluate and treat. So they're relying on our expertise, which is evaluating biomechanics, to do our assessment and then come up with a plan and let them know what our plan is to treat their patient.
Right, and physical therapists, in case you are not aware, it's they have a 4-year degree, they get a master's, a doctorate. I mean, it's a profession that is really, I think, striving to become really a player.
Absolutely.
In the field. Now, if suppose I had one leg shorter than the other, and I come to you and you're going to kind of guide me through this, what can you do to help me?
Well, it depends. If it's strictly a leg length problem, somebody comes in, somebody's had a fracture as a child and one leg hasn't grown enough, sometimes something as simple as a lift in their shoe or a lift outside the shoe, depending on how extensive it is.
And that keeps the balance of your body.
That can help keep them straight. If, say, there's some kind of, a lot of times if you're getting somebody later on in life that's been compensating for that leg length discrepancy over the course of many years, then that's when things get a little more complicated. You have to start looking at what have their feet been doing for decades, what have their hips been doing to compensate for this, and then at that point you may apply the lift, but then you may also do some physical therapy to straighten out the pelvis. You may make some orthotics to straighten out the arches. Things like that have to be assessed. So it's a pretty complex biomechanical problem, but you want to take a look at everything. It's not just as easy sometimes as my leg is short, let's stick a lift under there and off you go. Most times there has to be some retraining because people have been doing something one particular way for their whole lives.
Yeah, it's hard to change that pattern. If you've done it 10 times, they said it becomes a habit, something like that.
Correct.
I know that we're talking about physical therapy, and I know that people might be wondering, how do I pick a physical therapist? Do I just go to the phone book and run out? We've met Will Smith, but the point is, how do you find one?
Well, I mean, there are a lot of good physical therapists in this area. I think primarily, most times people find us typically word of mouth. Patients who are happy with a particular therapist will tell somebody else and refer friends. A lot of times certain physicians rely on certain physical therapists, and a lot of it is developing a rapport with people in the community. So most times it's by referral. I'd say most of my patients come via word of mouth, somebody telling somebody else that they had success and they did well, and so on and so forth. I work with a lot of groups in the area. I work with the local triathlon club, the local running groups. So, I mean, that's how I typically find I get my patients.
And you give talks as well.
Yes, and actually come to speak of that in September, on September 11th at Fleet Feet, which is a local running store. I'll be giving a free presentation on how the foot and hip biomechanics are related to the body, and anybody's welcome to come. They're going to open up the whole store after it's closed and have a presentation there.
What time would that be?
It's going to be at 7:30 on September 11th.
Okay, can't forget that date.
No, it's a good date.
Yeah. So if you want to learn more about physical therapy, you can certainly go to his website and find out more about that, and find out maybe how it can help you. Physical therapy is a tool that should be used actually more than it probably is, rather than always running to a physician and when you don't have a problem that really relates to medical but to physical.
Absolutely.
What a segue there, huh?
Great.
Great.
You.
Well,
Pleasure.
so nice to meet you. Yeah. And I'm so glad that you're here, and I hope that you'll maybe check out physical therapy, knowing that you can get direct access if you want to, and find out. Maybe you're a runner, maybe you need to find out more about your feet, huh?
Absolutely.
Good.